tonight. Tonight I'm going to talk about HIV and COVID-19 and some things that particularly to people who are living with HIV should be concerned about. Next slide, please. What I'll be talking about tonight are the objectives are going to be what is COVID-19, what are the symptoms and treatments, and I'll be talking about transmission and prevention. Next slide, please. Next slide, please. What is COVID-19 and how is it passed on? COVID-19, coronaviruses are a family of viruses that cause illnesses such as the common cold, and in this case, COVID-19. The name coronavirus has to do with what the virus looks like under a microscope. Corona means crown, and all coronaviruses have a similar structure. They are called enveloped viruses, which means they're able to stick to surfaces, but are also able to be killed with disinfectants. The virus is called novel because it started with an animal population and was transmitted to a human, and now can go from human to human. And there have been some reported cases of humans passing it on to their pets, their dogs and cats, however you can get it from the dogs and the cats. Our immune system hasn't seen this particular strain of virus before, so none of us have developed immunity for it. At this time, there's not a vaccine, but the good news is there are about 95 clinical trials for a vaccine worldwide. It is more likely that this virus is more contagious than influenza or the common cold because it's so new to humans. We aren't used to it. We have a way to fight the other viruses that come along, like the common cold or the flu, but with this one, we just don't because we aren't used to it. Next slide, please. This results in the virus causing more damage to the cells and producing inflammatory cells, which can damage the body trying to fight off the infections. For people with decreased immunity because of medications or because of special conditions from aging, the result of the COVID-19 disease can be much more serious. Currently, there are about 141 million cases in the United States and about 83,000 deaths in the US. Worldwide, there are about 4 million deaths, 4 million cases and about 249,000 deaths. Here in Texas, this slide was from May the 5th. And you can see that at that time, there had been 427 tests. There had been 33,000 reported cases. And at that time, 906 fatalities. As of yesterday, May 15th, there were total tests done in Texas were 587,000. 42,000 cases have been reported, and there have been an estimated 1,158 fatalities. Next slide, please. Here in Harris County, the breakdown by race and ethnicity is for the Black population, it's about 15.6%. For Hispanics, 37.4%, and for white, 28.1%. Asian is 3.9%. It's pretty evenly split between males and females. And again, this data that I did was from May the 5th. Harris County has a population of over 4 million people. And on the 5th, we had 1,000 cases here in Harris County and the city of Houston. To date, as of May 14th, we have 13,000 cases, and we have about 334 deaths. Next slide, please. This shows that another thing that you can see is New York City. New York City has 171,000 cases and 43,000 people just in that city have been hospitalized. What are the common symptoms of COVID-19? The common symptoms, of course, dry and a continuous cough, fever when you're back or you're just hurting all over, feeling tired, and other flu-like symptoms. Some of the new symptoms that are being seen too are a loss of taste or a loss of smell. And some people have had diarrhea and GI upset, And the thing that's most concerning to us is a lot of people are actually infected with the virus and have absolutely no symptoms. And the problem with that is they may not have any symptoms whatsoever, and they're around people and they're able to spread that virus even though they aren't showing any symptoms. Just recently, in the past week, we thought that children were safe from this disease, and we were proven wrong. As of yesterday, the 13th of May, over 100 children have been infected with the COVID-19, and they're showing symptoms of something similar to Kawasaki disease. And Kawasaki disease is a syndrome that affects the different parts of the child's body. They'll show signs of a rash, conjunctivitis, which are the red eyes, swollen hands, red cracked lips, and unfortunately, this can lead on to aneurysm, enlargements of the heart, and enlargement of the coronary arteries. And unfortunately, we've had some deaths in children from COVID-19 from this particular virus. Next slide, please. So how do you prevent COVID-19? How can you prevent it? Well, of course, the first thing that you can prevent, of course, is to wash your hands. You've probably heard that a million times, but it's really, really important. And it doesn't have to be with a disinfectant. It can be just plain old-fashioned soap and water. The thing is to wash it for at least 20 seconds and wash the back of your hands and the front of your hands. This is the really hard part, for me especially, is to avoid touching your face, especially your eyes, your nose, and your mouth, because they found that the coronavirus can enter your system through those areas, through the nose and through the mouth. That's why it's really important, if you're around somebody who's sneezing and coughing, that you avoid them, especially, and the recommendations are to try to stay at least 6 feet away from somebody. If you have to cough or sneeze, it's always best to sneeze into a tissue, then throw away the tissue and wash your hands. If you don't have tissue, use the inside of your elbow to cover your mouth. And of course, stay at home is the best way to try to avoid this virus. Next slide, please. Now, what do you do if you have symptoms of the virus? Well, what you can do is, number one, stay at home and call your local health service to see about testing. And at the end of this presentation, there are going to be some contact numbers and some contact websites for the City of Houston and for Harris County. If you are ill, ask your friends or neighbors to leave supplies outside the house. Again, avoid close contact with anybody else. Stay at least a foot away. If you live with other people and you have been diagnosed with the coronavirus, it's best to avoid any contact with them. Don't share plates and cups. Don't share the bathroom with them. If possible, stay away completely from other people, especially if you've been diagnosed with COVID-19 and you're living with somebody who is elderly, who has a immune deficiency. It's best to stay away from those people. Most symptoms can be managed just with resting, drinking liquids, and Tylenol, not ibuprofen, Tylenol. And if your symptoms don't improve, next slide please, after 7 days, or you have difficulty breathing especially, you need to call your physician immediately. Don't just show up at the hospital or the clinic, call them first, because they may tell you to go straight to the emergency room. Now, if you're living with HIV, there are a couple of things that are particularly important. Again, follow general precautions to make sure that you don't, if you've been exposed to the virus, wash your hands well, wear a mask, and try to stay away from people. It's really important at this time to take your HIV medications. If you have a really high viral load, if you have a low CD4 count, your immune system is not going to be working as well as it should be. So it's really important right now. Do not stop your treatments at all. You've got to be able to fight this infection. Make sure you have a 30-day supply of your medications, ideally 3 months. Right now, doctors have been instructed by Health and Human Services to make medications available at whatever cost. As some of you have probably experienced, telehealth as far as meeting with your physicians. Instead of going to the office, to do it over the phone, do it over your tablet, is much safer at this time than actually face-to-face and going into a crowded clinic. Immunizations are extremely important right now. Your flu vaccines for people over 60, pneumonia vaccines, and especially the shingles vaccines. But if you come down with a COVID-19 and you haven't had those vaccinations, put those on top of the COVID-19, and you're really hurting yourself. A really hard part too is you want to have healthy lungs. How do you have healthy lungs? If you can, stop smoking. Any type of use of inhalants should be prohibited. Vaping or anything that's really irritant to the lungs should be highly avoided. Again, if you're not feeling well, stay home. And it's really important that you eat well, you exercise, and look after your mental health. Right now, there are a lot of clinical trials on antiretrovirals to see if they can affect the COVID-19. Some of you've probably heard of Kaletra being used, and that's under clinical trials right now. Remdesivir is an antiretroviral, and it's under review for clinical trials. It's shown a lot of promise. And hydroxychloroquine is one that's also being used. But again, the recommendation is if you're living with HIV and if you're on PrEP, you should continue to take all the precautions and stay on those medications. Next slide, please. Social isolation is a problem that we're seeing that's causing some serious effects. There's a big difference between social isolation versus the social distancing. Social isolation means staying away from other people and not talking to people, and that's not what we want to do during this virus. Social distancing is what we want to do, which means keeping at least 6 feet away from each other, avoiding large crowds of people. Next slide, please. What is social isolation? It's the absence of social interactions, contacts, and relationship with family and friends, and with neighbors on an individual level, and with society at large. And that's what we're trying to do right now. But we're definitely, we're trying to social distance and not social isolate. Next slide, please. What are the effects of social isolation? What are the effects of not talking or being around people? Well, studies have shown that one's health risk can increase as much as smoking 15 cigarettes a day or misusing or abusing alcohol. Social isolation can lead to increased risk of early death. Social isolation can result in decreased immunity and an increase in inflammation. And inflammation is not what you need with this particular COVID-19 virus. Next slide, please. So what do you do to combat isolation? There's a lot of things you can do. Create a schedule and maintain a routine. Eat healthy, exercise, even if it's just around the block. You don't need to be with anybody to do that. Wave at your neighbors as you walk or in your neighborhood on the porch. Get outdoors, get plenty of rest. Stay connected through phone or video calls. Our Ryan White Council members are calling each other just to say hello and just to check on each other, just to make sure that everybody's okay and that they're not socially isolated. This is a great time, and a lot of people are doing this around the country, is to foster or adopt an animal. It's really a comfort to have a pet in the house, a dog, a cat, whatever. Look for things that are humorous and try to stay positive. Next slide, please. If you have any questions, there are two great websites. One is the Harris County Public Health Department has a website that you can go to, and the Houston Health Department has a website you can go to. Now, these two sites will give you the latest information on what's going on with this virus and contact numbers to call if you want to get tested, and information about changes to the virus that I've discussed, because what we're seeing is every week, if not every day, we're seeing things that are changing the course of this virus and how we can treat it. So that's the end of my presentation.